Hi, everyone. Hope you're all doing well. We are so excited. I'm so excited to have this amazing live today with some three amazing guests that you're just going to love hearing. We are doing something a little bit different today, so I hopped on just a couple of minutes earlier to let you guys all know that, this time around you must have seen we have three people joining us, three experts in the field of dermatology who are going to be joining us as opposed to one. So it's going to be really exciting, really fun. So bear with me as I switch off between guests. There might be a little hiccup here or there, but we're going to get through it, and I'm super excited for you to meet them and to hear from them. So, I thought this was really important for us to talk about, the skin findings in COVID. So we're in the middle of this pandemic. It's been over 6 months now. And early on when this started, we didn't really hear much about skin findings in COVID-19. It was really mostly about, respiratory symptoms. You heard a lot about cough and fever and shortness of breath, but you really didn't hear much about rash. And it's only later that we started seeing some of these findings. There are some things that are very, particular with this illness, and there's some things that are a little bit more vague. So I thought it was really important that, we have this conversation and that I bring you really experts in the industry who can talk about the things that they're seeing and talk about their perspective and, answer your questions. So I'm really excited. We're going to get started with our first guest.
Hey, Asmaa, how are you?
Hey, Adarsh, how are
I'm
you? How's
great.
it
I'm great.
going?
All's good. Good to
So,
see you.
so good to see you. It's been a little while.
It has. It has. A lot's changed. A lot's happened in the world since when we last talked.
Exactly, exactly. Thank you so much for, doing this with me today. I'm really excited that you could be here. I think it's really important that we get the right information out there, and who better to do that than you? So thanks again for doing
Pleasure.
this.
It's my
So
pleasure.
before we get started, I want to actually give a formal introduction so people know a little bit about you. I'm assuming that a lot of people know about you already. You're quite, you have an amazing, presence on social media especially, and you have a big following. But I want to give
Thank you.
people who may not be familiar with you a formal introduction. So let me tell you about Dr. Adarsh Mudgil. Dr. Mudgil is one of the few dermatologists to be board certified in both dermatology and dermatopathology. This gives him a unique understanding of skin disease and allows him to approach patient care from both a clinical and a cellular perspective. He treats patients of all ages, from newborns to geriatrics, and is versed in all aspects of medical, surgical, and cosmetic dermatology. Dr. Mudgil received his bachelor's degree with Phi Beta Kappa honors from Emory University and his medical degree with Alpha Omega Alpha honors from Stony Brook University. He was among a handful of medical students nationwide to have been awarded a coveted Howard Hughes Medical Institute Fellowship and Scholarship. Through this funding, he conducted nationally recognized research focused on pathogenesis of cutaneous squamous cell carcinoma. He completed his residency in dermatology at Mount Sinai Medical Center in Manhattan, where he served as chief resident. He then went on to complete a fellowship at the prestigious Ackerman Academy of Dermatopathology. Dr. Mudgil is a member of the Mount Sinai School of Medicine teaching faculty, where he is actively involved in the education of medical students and residents. So thank you again and welcome to this live.
Wow, Asmaa, sounds like I know. It sounds like that guy knows what he's talking about, huh?
Well, you sure do. So, again, thank you again. I know you're very humble, and, I just wanted to really do a formal introduction so people really hear about, how qualified you really are. So, you do amazing things for your patients. So
I
thanks
appreciate
for
it.
being here.
Thank you.
So, we've been through a lot in this pandemic. As you mentioned, it's been a while since we chatted. We spoke early on in the spring when we were really, having our surge of cases and things were kind of, starting to get really hectic and, very new territory that we were in. And I remember back then you were still seeing patients in your office
Yeah.
and we chatted, and I was so moved by that. And it was so humbling to hear that, you were willing to put yourself at risk. Obviously, we are still learning a lot about the virus, but, initially everybody was very concerned about the risk, and how well protected physicians could be, because we didn't know much about the virus. But you were willing to do that because of the patients and that you care for, and you really went above and beyond to take care of them, because you really didn't want to send them to the hospitals unnecessarily, where they would be at risk of having unnecessary exposure to COVID. And I was really moved by that. And I wanted to talk a little bit about how things were at that time in the beginning of the pandemic for you in both your practices, both in Long Island and in the city, and what kinds of patients you were seeing, at that time in your practice.
Yeah, so thanks so much, Asmaa. I appreciate that. So we were probably one of just a handful of dermatology practices that stayed open in Manhattan and in Long Island. Most places closed, but in the city, everyone shut down. So most of the dermatologists there just skipped town and went to their Hamptons house. And even during the height of the pandemic, my assistant and I would just go in, the two of us. We'd drive in together, and we'd see on Friday mornings. We'd see whatever emergency patients there were, and I'd do the same thing in my Long Island office. And the reason why I did that was, one is, even though dermatologists are like the soft doctors, I felt like we're doctors, though. We're still doctors, and when there's a pandemic, that's that's doctors should run towards a pandemic, not away from it. And I wanted to stay open for that reason. But there was actually a lot of pressure on social media for dermatologists to close down. A lot of the derms were closing down, and they were posting these things on Instagram, like, we're doing the responsible thing and we're closing down. So staying open was almost kind of like an iconoclastic move. I was going against the tide, and there was some pushback.
Right.
No one's ever said anything to me personally, but of course, you hear things.
Right.
But that first Friday, so it was like that, the city shut down like around March 24th. It was around that date. I can't remember the exact date.
Yep.
That Friday, I went into the city just to see. We weren't doing any cosmetics at that time, so I wasn't doing any Botox or filler or any of that stuff, But I saw 2 9-month pregnant women that had abscesses, and I saw another pregnant woman who had shingles. And really, that was all I needed to know, that we needed to stay open. And so we stayed open during the pandemic. In fact, I even told my staff that I had to cut back hours, because really operating during that time, I'm in private practice, was at a major loss. I mean, I lost a ton of revenue because my overhead was the same. So I have a practice on Fifth Avenue in Manhattan. I have a building here in Long Island. I wasn't getting any break for my overhead, so I still had to pay all the overhead fees. But the only way I could make a concession was by cutting my staff back a little bit. So I cut most of the folks back to basically half time, except for a few folks who I kept full time. And I told my staff quite honestly that, listen, I can't afford to pay you like what I have been paying you. So if you guys want to go on unemployment, I'll fire you, and you can collect unemployment, which will be more than I'm able to pay you. But I can't guarantee that I'll be able to bring you back, because I didn't know what was going to happen at the end of those 3 months. But everyone stayed. Really, my team was so ride or die during this whole thing. And
That's
without
amazing.
them, I couldn't have done it. And I owe everything to my staff. But I felt like we did provide some value, especially as the pandemic evolved. And, there were more skin issues, and, people were really, honestly, people still needed their skincare, and it was months.
Yeah.
The city was closed for months. So that's why we did it.
Absolutely. And that story, I remember hearing that as well when we chatted, that, it was these pregnant women that, really are high risk, and, their alternative to take care of their health is to go to the ER. And the ERs were just getting overwhelmed with COVID patients. And that's really risky for them. That's the last place you want them to be. So again, I want to thank you so much for taking care of everybody. And I know it was a difficult time, but eventually you did transition to telemedicine, right?
Yeah.
So as the pandemic is then going on and you are now seeing more patients, with telemedicine, what kinds of things were you seeing at that point?
So actually, I implemented telemedicine the week before everything shut down. So I saw what was happening, and I got my infrastructure set up, and we were ready to go. So even that first week, we were doing telemedicine visits. That first Monday the city was closed, we were already rolling with telemedicine. So I was really just seeing mostly more. A lot of folks being a dermatologist, you're at a party or something, and everyone's showing you, hey, can you take a look at this spot? Or you can take a look at that spot. So a lot
Shirts are going up. They're going in the corner. Just take a look at this rash I have.
Shirts are going up, pants are going down. But it was a lot of that. So a lot of folks were stuck at home, and they would see a spot on their skin. They couldn't go see a dermatologist. So they were obviously freaking out. Like, oh my God, do I have a melanoma and I'm going to die in my apartment, you know? So it was a lot of like, you know, evaluating spots, and I'd have the patients take like a high-res picture just with their iPhone and send it to me, and then we do a telehealth visit. And in fact, some of the spots I actually had a melanoma. It wasn't my. I also am a derm path, so I actually diagnosed a melanoma during like histologically during the course of the pandemic. And I had a few patients that had skin cancers that I would see. So I'd do a telehealth visit during the week and I'd say, hey, why don't you come in on Friday? We'll take a biopsy of the spot, and you know, so. And a lot of it was that. Then a lot of the stuff was just my routine acne follow-ups and, you know, things like that. And then, of course, rashes are, you know, spring. So you always see like the slew of like the poison ivies and that sort of thing. But then a lot of, you know, people were starting to read about COVID-related rashes and, you know, and get, you know, consults for COVID toes and, you know, just other stuff. I remember very early on, one of my friends who's a plastic surgeon, his wife had like, you know, widespread urticaria, which ended up, you know, most likely being from exposure to COVID. So yeah, you know, you're just seeing, you know, all kinds, just the regular stuff that I would typically see.
Changing. Yeah. But that's also a really important thing that you highlighted there, that, you know, being on the front line, you know, initially there was so much changing, you know, during the pandemic, but we certainly in the beginning didn't want people coming to the ER necessarily. But then what we found was that people were sort of delaying their medical care as well. So a great point you brought up about diagnosing that person with you were able to do a biopsy and diagnose them and not delay their care or their treatment. So again, you know, something that's so important. And then as the pandemic kind of progressed, I guess you were seeing more COVID related, you know, skin findings, which again, luckily, because you were available and doing telemedicine, that patients were able to seek you out. So really thank you again for doing that. So what are you seeing in the community now? I mean, especially in our community, we've come a long way from March till now. You know, we've really, you know, New Yorkers buckled down, you know, we sort of, everything was on pause. We sheltered in place. We've gotten to a point now where we're less than 1% positivity rate. And things have really changed drastically. You know, what is it that you're seeing in your practice now?
It's almost embarrassing to say, but you know, the first week the city actually opened up, you know, like doctors were able to see patients. I've never done more Botox than the last few weeks. I mean, you know, like a lot of the patients who are like sort of on a regular cosmetic schedule, they literally, I mean, it's crazy. I literally must have ordered like $15,000 worth of Botox to like satisfy the demand. It's been insane.
Wow.
So a lot of folks are doing their catch up for dermatology stuff, because a big part of my practice is aesthetic.
Right.
You know, in terms of COVID related stuff, the only thing I really saw were COVID toes. I saw a lot of them. And it was pretty common. It was interesting because the minute it was reported, and there was like an article in the New York Post, which kind of went viral here in the New York area. All of a sudden, everyone started having COVID toes. And then I have not seen anything, you know, it was just for like maybe four to 6 weeks where I was seeing a bunch of that. And then that was it. You know, it's almost like the Kawasaki's like syndrome. Like there was a few reports of it and it was like, okay, it's like, you know, it was blowing up and then you don't hear anything about it anymore. Such a strange virus, you know?
So it's really interesting that you say that, because from my perspective on the other side, because I'm mostly inpatient in the hospitals, we rarely saw COVID toes. I mean, I knew about it, I'd read about it, but you know, what we knew early on was that there was this correlation with milder illness. So that's why those patients were not really coming to the hospital. So you would see them more in the office, but it's really, you know, the virus is really peculiar. You know, it's something we've never seen before. There's so many different things that it does that we just, you know, have never seen with any viral infection. You know, viruses, as you're aware, you know, do have a lot of skin findings, you know, in children. Were you by any chance seeing any pediatric patients throughout this time?
Actually, a big part of my practice is pediatric dermatology. I see tons of peds patients, but nothing nothing COVID related. Just the routine stuff, you know, like the typical stuff that kids get. I will say, if you let me just get a little nerdy for a minute here.
Yeah, of course.
So, you know, we do serology. We do blood work in both of my offices. So, you know, I have a lot of patients on Accutane. I do a lot of connective tissue disease stuff as well. So, like, blood work is a big part of what we do. So every patient that had COVID toes, I would just have them sneak into the office when no one was there. We'd do antibody tests for them. And interestingly, every single patient tested negative for antibodies. And you know, it's interesting. I was talking to one of my other colleagues who's, you know, he's a very smart primary care doctor who's in the same building as me. And we were kind of sort of hypothesizing about this. One is I tested negative for antibodies, which I can't believe because the week before the city shut down, I probably saw 150 patients in my New York City office. Everyone was dying to come in, and my waiting room was, it's a tiny office in New York City. It's, you know, it's a city. Everything is small there. My waiting room was standing room only. Like we were on top of each other. Like people just wanted to come in. Again, then it was like a surge for Botox before the pandemic.
Right.
So people were like coming in for all the, before things shut down. I went to the Nets game that Wednesday. The lady sitting next to me was like hacking all over me the whole game. And so, you know, yeah, so I was shocked that, and interesting enough, my assistant who was with me all the time, we used to drive into the city together, tested positive. We're always together. You know, she's my number one, you know, a person I'm always with when I'm seeing patients. So I had a lot of potential exposure. And I do think, so viruses predominantly are a T-cell mediated response. You know, so for virus and fungus, you know, if you think back to your immunology in medical school, it's predominantly a T-cell mediated phenomenon. Perniosis, which is what COVID toes are, it's called perniosis or chilblains, is a T-cell mediated, essentially vasculitic process that happens, you know, on the extremities. So personally, and I have 3 little kids, you know, I've been exposed to coronavirus, I'm sure, many times, maybe not this particular strain of coronavirus, but coronavirus is around, it's in the community, you know, kids are petri dishes. So, you know, we were sort of hypothesizing about this, and, you know, the level of exposure that I have, like, you know, I must have been exposed. I must have a T-cell mediated response to this somehow. And that's why I never got sick. That's why I think these patients with COVID toes never got an antibody response. They were never sick enough to make antibodies, but they had a very intense T-cell mediated response, which caused like these weird skin findings like perniosis, you know? So, I mean, I think
that is definitely a theory that's out there, you know, for sure. And that kind of explains a lot of the people that end up being asymptomatic, you know, and mildly symptomatic, you know, that's definitely a hypothesis that's, you know, strongly favored right now.
Yeah. And I do think, especially in New York, I think there's I mean, this is not, again, everyone should wear their mask, wash their hands, socially distance, and all the things that we're supposed to be doing. But I do think that there's a higher degree of immunity than the antibody tests are indicating, you know, because of that potential T-cell immunity that I think I have.
I mean, the other thing that we have to remember with that is also, unfortunately, there are so many tests that are out there, right? And a lot of the tests have not even been validated or FDA approved. A lot, you know, the FDA gave emergency use authorization to so many tests. And, you know, so all tests are not created equal, essentially. And then the timing of when these tests are being done is also something that's interesting to look at. You know, only time will tell us exactly what the case is. Right now, we're still in that mystery phase, but, you know, certainly, you know, so many things that are still yet to be uncovered about this virus and this illness. Now I wanted to touch a little bit about, you know, go ahead.
I actually have a funny story about that. So when like there were these like black market tests that you could get kind of like in the middle of April from China, and you know, I got like a phone call, kind of like the guy who's like opening up his jacket and they're saying, "Hey, you want to buy these watches?" So I got a phone call asking if I wanted to get some of these COVID tests or antibody tests, kind of like those pregnancy test ones, you know, like the rapid antibody tests. So I was like, definitely. Send me some. Send me like 30 of them. Or you had to buy them in combination of 30. So literally, I was certain I had antibodies. And, you know, so I tested all my staff. Everyone tested negative. I tested myself. Literally, I tested myself. I was negative. I was like, it can't be right. I tested myself. These are finger stick tests. So I literally stuck every one of my fingers. I did 5 tests on myself. They were all negative. God. But speaking to how inaccurate these tests are, so my assistant tested negative also, but when we did serology tests, she tested positive, you know, so those tests don't really work.
Yeah, absolutely. It's really important for people to know. And we say this over and over that, you know, the antibody testing is not really helpful for diagnosis of illness. You know, for that, we want people to get, you know, the nasopharyngeal swabs, you know, and obviously there's some more like saliva tests and things like that are in the pipeline. But antibody tests are useful for us to know, you know, collect the data and see what's been happening, you know, in the last couple of weeks. But yeah, hits the nail on the head that, not all tests are created equal. And,
Yeah.
in April, I'm sure I would have been curious to see as well, like, oh, let's see how good these tests are.
Yeah. They
But
were
I
bad.
wanted to talk to you a little bit about rashes in general.
Yeah.
Okay. So now for our audience, for our viewers here, as an infectious disease physician, I see a lot of rashes. As a dermatologist, you see a lot of rashes. And both of us know that, not all skin rashes are the same. And there's, a huge variety of reason for different types of skin rashes. But most people don't know that. They're not aware of that. Something even that we've seen with COVID, livedo reticularis, a skin finding, can be seen in other conditions. So, what can you tell people in general about skin rashes and just, how diverse the origin can be and just, some pearls for people to understand?
For other clinicians, as private clinicians here, or?
Well, it could be either, physicians and the general public to
Yeah.
know that, not all rashes are originating from the same thing. And then you can talk about even livedo reticularis for
Yeah,
physicians to
sure.
know.
So basically, when you're exposed to a virus, your immune system does all kinds of things to try to fight the virus. But because of that, there's often a lot of collateral things that happen, and the skin is sort of a window into what's happening in the body. So, for instance, like before you mentioned livedo reticularis, typically that's some sort of vascular process. So if someone has like a clot in their leg or something like that, frequently what you'll see on the skin is this livedoid pattern. It's like this reticulated red, purplish look, And so really when you see that, you're thinking, generally it's something bad, So when you see livedo reticularis, you can see it in various connective tissue diseases and things like that as well, like lupus, and some folks with even certain forms of arthritis can show livedoid reticularis. But in this particular situation, like when you see it, generally it's indicating that there's some kind of vascular occlusion somewhere. And it's typically a smaller vessel that's getting occluded. And when that happens, this is the cutaneous sign that you see. You see this pattern. So a lot of times you can see that in like folks who have meningitis and where they can actually get necrotic patches of their skin, or even in folks who are exposed to gonorrhea, you can see that. It's just a sign where there's some kind of vascular involvement. Now that vascular involvement could be because of inflammation, where there's a lot of inflammation, and that causes the vessel to kind of become smaller, and there's little clots that form, or it could be like with COVID, where folks were getting pulmonary emboli and strokes and stuff, where they're actually forming, their blood became hypercoagulable, meaning that it clotted easier, and that's how you get these little clots, which can affect all the organs, including the skin. Other weird things that happen when the immune system gets activated, particularly by viruses, hives is a very common thing that happens. And basically, the mast cells get stimulated and they release histamine, and that causes hives. And hives can have millions of causes. It can be from if you're allergic to strawberries, or you're allergic to shrimp and you eat that, or sometimes you can get a bug bite, and that can set your immune system on fire, and you can have hives for a month after having a bug bite. In COVID, you can get that too. It can stimulate your immune system to make hives. And frequently you can have hives way beyond even having your COVID resolved. It can persist for months beyond, that primary exposure that caused it. The sort of classic thing that you see with viral infections is, primary care doctors love to say macular papular rash, or a morbilliform eruption, which is morbilliform means measles-like, because this type of rash you get with measles, which is a very non-specific rash. There's a sort of red patches all over the body, which is very common with viral infections. You can also see that it looks like a drug rash. They all look very, very similar. But the key in these situations, like being a dermatopathologist, is getting a piece of skin to look at it under the microscope, because on the skin things can look different, and but really you have to look at stuff at the cellular level and see where the inflammation is. Is it around the vessel? Is it at the junction of the skin and the dermis? These are all little clues that can allow us to really precisely say, this is why this rash is happening. And even that's not an exact science. There is a little gray there too, but that's the most important thing, coming from a path perspective.
I love that. I have to tell you personally, as an ID physician, that's music to my ears, because every time I'm called to see a patient with a rash, it's not necessarily that it's related to an infection. So, for us, we always like having a tissue diagnosis, sample of the tissue to really have the diagnosis. That's really the way to do it. So thank you for doing that and for reiterating that. So before you leave us here today, is there anything that you would like everybody to hear, everyone out there in America, throughout the country, throughout the world? Are there any final thoughts you want to share with everyone?
Yeah. So, being a doctor of private practice, I'm essentially a small business. And a lot of doctors had to close down. My wife is a dentist. She had to close her office down for months. And, we're at a point now in New York where we're in a good place, but other places in the country are not in a good place. And, just think about your favorite restaurant that you love to go to, or your favorite bar that you love to go to, your favorite coffee shop that you love to go to. That's not like, or your favorite store. That's not like a Starbucks or a Target or some kind of chain restaurant, because all of the value of our communities are those mom and pop shops, those little spots that are unique, that they only exist in one place, where you go out of your way and you'll stand in a longer line to go to those places. Well, in New York City right now, because when I walk around the city, a great majority of those places have shut down and they no longer exist. And likely they will never, ever come back. Some of my favorite restaurants where I've been eating at for a decade, near my office, are destined never to come back. So it's there's a lot of damage that's been done. I could tell you, if there's a second shutdown here in New York, it'll be the nail in the coffin. And for a lot of places, a lot of small businesses made it through that short period to make it back, only to basically being able to barely survive now and still being in debt from the shutdown. If you have to shut down again, then it's over. It's done for most small businesses, actually, I'll say, even including your doctors, even your doctor's offices. So it's our responsibility as a community to wear our masks, to be responsible, to don't listen to Trump, listen to Fauci, do what is the responsible thing for our communities, because the flavor of our communities is going to be lost if there's another surge. And we know enough about this virus now where we can make the smart decisions. Doctors have learned a lot. So it's time that, it's very important that we all listen to them, and, really keep this thing in check.
That is just so beautiful. I can't thank you enough for really saying the message that really needs to just stay with New Yorkers and Americans, actually, throughout the rest of the country, because we know that the numbers are not looking good throughout the rest of the country. And people just need to, we really need to come together and do it for each of us, for all of us. There's a reason why we say we're in this together, because everyone's actions have a direct consequence on everyone else's health, livelihoods. And, the only way to move forward from this is if we collectively, do the right thing. So thank you again, Dr. Mudgil, for being here, for all of your amazing input. And I can't wait to speak with you again soon.
Thank you. It's a pleasure. Let's get it.
Take it. All right, guys, we are going to be getting our next guest on. And we are so excited to have our next guest with us.
Hi.
Hello. Hi. Hey. How are you, Asmaa? So happy to see you. Yeah, it looks great.
Okay, can you hear me?
I can hear you perfectly.
All right.
Awesome.
The ending message from Dr. Mudgil was everything.
Everything, yes. That's what people need to remember, that's what it's all about. So before we get started, I want to do a formal introduction so people that don't know you can hear about the wonderful accolades that you have. So joining us now is Dr. Asmaa Chaudhry, who is a native of Georgia and moved to Virginia in 2006. In Georgia, she graduated top of her high school class, after which she was awarded the highly coveted Presidential Scholarship for her undergraduate studies. She subsequently graduated with the highest distinction of summa cum laude with a Bachelor of Science degree from Georgia State University. She earned her medical degree from the Medical College of Georgia, then completed her internship in internal medicine at Virginia Commonwealth University. She went on to complete her derm residency at Eastern Virginia Medical School in Norfolk, Virginia, and attained board certification in dermatology. In addition to her passion for treating skin diseases, Dr. Chaudhry is a skilled and prolific scientific author with publications in top peer-reviewed dermatology journals. She has presented her work at the local, state, and national level and has received accolades for her research in the field of dermatology. Welcome, Dr. Chaudhry.
Thank you. It's so great to be here. I'm a huge fan. I have really thoroughly enjoyed the conversations of color that you've done and watched with my family. We are huge fans. And now the conversations of COVID. So thank you for including me. It's an honor.
Of course. Thank you for being here. So I want to get started and tell people, give people all the information that they really need. So you've been seeing patients in your office now, and you've been seeing a lot of skin-related findings for COVID, as well as hair-related issues, right? I think that's been very prevalent in the community. Can you tell us a little bit about the skin changes that you've been seeing, especially as people are, really dealing with a lot of stress?
Yes. This is a novel everything, right? And so we're learning as time goes on, and we will continue to learn for years to come, but this is novel everything. And this was a firsthand glimpse in, what you do and how you function when you're not prepared. And so, just a quick little background, I had taken a little sabbatical and was building out my new practice. And with great excitement, had a start date, opened my new practice on March 10th. And on March 13th, the governor of Virginia issued stay-at-home orders. So 3 days into my new practice, when, we're excited about seeing all these patients that I hadn't seen in months because I had taken a leave to build out my new practice, suddenly, all that excitement is now transitioned into how are we going to do this? This is not what we were expecting. I have a, new practice in its infancy. And I had 8 years worth of patients that were following me to this new practice. And so a lot of people had been waiting, and we transitioned to telemedicine on day 3. And so, when you've got so many years worth of patients that are waiting to see you, there's a lot of the mundane and usual stuff that we see, right? We do a lot of full skin checks, and we've got cancer follow-ups. And so as we were transitioning to telemedicine, we decided that everything that really wasn't urgent needs to wait until it's safer to come in. And so in a way, we were selecting for urgent cases in telemedicine because we had told all the patients, it's not urgent, it's a routine follow-up, please, wait until it's safer to come in. So in telemedicine, of course, we're seeing a ton of patients with acute rashes. And so, the first couple of days I see, and because we're limiting the number of cases, I'm not doing a full clinic, and so the first couple of days I'm seeing 3 or 4 shingles. And the next few days after that, I'm seeing like 4 or 5 shingles. And the next week after that, I'm seeing, 15 shingles a week.
Wow.
And so, and shingles is, remember, this is something that we see commonly, right? But just this uptick in the number of cases, right? And this is now when the schools have been out. People are stressed to the max. The kids are at home. Yep. People are starting to lose their jobs. They're being furloughed. There's so much uncertainty. And so we're seeing at that time just this influx of this rash. And they would, so that was one problem. But another problem is just sort of the daily care that people have started to institute. We're telling people to wash their hands, wash, sanitize your hands. Yep. And so there's a huge uptick in the number of people that have hand eczema and contact dermatitis and inflammatory rashes just due to overwashing. So those types of things increase in number, astronomically. And then, hair loss. People are losing their hair. They're stressed to the max. And so, hair loss is just kind of one of those things that's difficult to treat and really to diagnose on telemedicine. I need to be up close and personal. I need to do some tests. I need to look at the follicle and the scalp and the hairline. There's a lot of things. Sometimes I have to do blood work. But there were a lot of reports of people just saying, I, comb my hair or I shampoo my hair and my hair is falling out. So, there was a huge uptick in those cases. Telogen effluvium, that's what we call the stress-related sort of hair shedding that we experience. A huge uptick of telogen effluvium. And it's, it's something that most people have experienced at some point. Asmaa, I know you probably have as physicians.
Yes,
right. We're accustomed to stress and working in grueling conditions. And so this type of stress-related hair loss is something that we see and we experience, but our hair is so intimately tied in with our psyche and how we feel about ourselves that imagine, when you're losing your hair and you can't imagine why, you haven't changed anything in your schedule and your routine, it's shocking, right? It's shocking. And, a common example of people who lose their hair sometimes is the postpartum hair loss that we expect people to go through. And I, as a physician, and then as a dermatology specialist, knew that this would happen to me after I had my kids. And even then, as I was going through it. I would stand in the shower and just cry when I would see clumps of hair coming out. So hair loss is a problem, and we've been seeing a lot of it. My colleagues everywhere have been seeing it. Like Dr. Mudgil was talking about, I'm a new practice. So, you know, my practice is in its infancy, and so I've got all those associated stress. So even I, along with my patients, am going through hair loss, right? So when they're coming to me and they're talking about, doctor, my hair is falling out and I don't know what's happening, I'm like, yes, look, my hair's falling out too. So, you know, it's so funny. My staff kind of jokes. They're like, you know, we can follow Dr. Chaudhry's trail of hair on the floor, and we can sort of, you know, we can know where she is. So those are some of the things that we've been seeing just as a stress-related response to COVID.
Yeah, thank you so much for sharing that. I mean, I think that's really important for people to hear. Just in general, you know, because of everything that's been happening nationally and globally, you know, as I was mentioning before, that people have really kind of put off, you know, their general medical care, healthcare maintenance and things like that. And then you factor in all these new variables, you know, everyone's wearing masks, we're washing our hands, and as you mentioned, sanitizing, and now we have all these secondary issues, you know, that come up that we are not anticipating. So it's really important. I want to thank you so much for making sure that you're there for your patients, that you're able to provide the care that they need, because, you know, everything essentially has a remedy, you know, and we certainly want people to continue with that good, you know, public health measures, continue with the good hand hygiene, continue hand washing and using the sanitizer, but just know how to treat and remedy, you know, the side effects from all of that they're experiencing now, the eczema and the dry skin and all of those variables.
Yeah, well, you know, and I just want to sort of echo what Dr. Mudgil said. You know, we're essential. Skin cancers don't stop because there's a pandemic. Melanoma doesn't stop because there's a pandemic. Those awful abscesses that people get don't stop. Inflammatory conditions, you know, full body psoriasis, all these severe skin problems don't know that there's a pandemic happening. And so even in my first week of practice in my new office, I think my second patient, we diagnosed melanoma. And so over the course of these several months that, you know, we've been seeing patients, that we've diagnosed several melanomas. And so, and these are aggressive. These are aggressive. We can't not diagnose these. And so, you know, there was always that balance in the beginning. How can we safely see patients so they get their medical needs taken care of, and also keep patients safe? Because again, I have a lot of elderly patients, skin cancer patients, a lot of immune suppressed patients. And so how do I keep them safe, but then still diagnose their melanoma? So we're essential, and it was tricky to know how many patients to see. How can I keep my waiting room empty? How can I keep this moving along? And just like what Dr. Mudgil said, my staff, absolutely second to none. I mean, were fantastic and really helped guide me. I mean, I'm telling you, on day 3, we transitioned this brand new practice in its infancy into telemedicine. And it was 100% the effort of my staff who got everything going and running, and just a smooth transition. I mean, I just am absolutely blessed with this brilliant group of people without who I could never have done this. But yeah, so thank you for that. You know, we are essential. We need to be there, and I'm glad that, you know, we were able to stay open and accommodate patients who really didn't feel comfortable coming in, or who had immune suppression, or, you know, so we could do both of those things.
Yeah, I really, honestly, thank you so much. And I think with technology, I think we've learned so much, right? Everybody, whether it be in the medical field, you know, we've transitioned to telemedicine and learned that on the go, or education, schools have, you know, turned into virtual education. You know, we're learning on the go, but we want to make sure that we are continuing, you know, with healthcare, providing healthcare or education while we're, you know, having to take the right precautions for, you know, for public health. You know, you talked about hair loss, which was, you know, really something that's been profound, I think recently, especially after the pandemic, you know, reached, especially in New York, after we had our peak, and as other states are experiencing their peaks right now, you know, stress-related hair loss, 100%, you know, it's really there with whatever people are dealing with, but also, you know, coronavirus-associated, you know, hair loss, we're seeing that too. You know, there's been, you know, reports of, you know, the effects on this virus is like no other virus, right? We know it's a multi-organ virus. It's affecting every single organ, including the thyroid. You know, people are losing hair because of that. that. And, you know, even after, you know, their initial illness, people are having, you know, consequences and sequela, we call them, afterwards, you know, after in the healing stages, you know, where they're recovering from their illness, where they have imbalances, you know, in their hormones and things of that nature. So I think that's another aspect of the hair loss, which I don't know if you're seeing a lot of patients that are coming to you after, you know, they've been infected and they've recovered, and they're saying that they are sort of having this struggle with, you know, I'm sure endocrinologists are seeing quite a bit of these patients as well.
100%. Yeah. So going back to the hair loss and the telogen effluvium. So this type of hair loss occurs about 2 to 3 months after a stressful event. And a stressful event is very loosely defined. It can be a car accident. It can be anything emotional, right? So it can be anxiety, stress, emotional trauma, going through a divorce. It can be physical, like I mentioned, a car accident. You had the flu, you had coronavirus, you had chemo, or, you know, you had some other condition that was inflammatory. All of these constitute stress. And so, you know, our hair is in a very beautiful dance. It's going through stages, and there are several stages of your hair and its growth. So there's an anagen stage where your hair is actively metabolizing and it's growing. Then there's a resting phase where it's not really doing much. It's not, you know, using up a lot of energy, not metabolizing. And then there's that shedding phase. And about 2 to 3 months after a stressful event, the percentages of hair and the cycles change. And so instead of 10% of your hair, which is normal, being in the shedding phase, that percentage can change. Maybe, you know, now 20% is in the shedding phase. Now, you know, maybe 30% is in the shedding phase. So, you know, if at any given time, it's normal to lose about 10% of your hair in the shedding phase, and it's normal to lose about 100 to 150 hair a day, that's the norm. If you go beyond that, if you go to 200 or 300 or 400 hair a day, that's something you really start to notice. And, you know, you'll brush your hair and you'll see tons of hair coming out. You'll wash your hair and you'll see tons of hair coming out. And it causes, that itself causes this anxiety that just kind of perpetuates the whole thing. So 2 to 3 months after a stressful event, your hair cycling changes a little bit. You get this massive shedding of hair. And you know what I always tell my patients is, this is kind of one of those good types of hair loss because it's not permanent. It's non-scarring. Usually the hair comes back. I mean, in cases of chronic stress, sometimes this is ongoing, but usually this hair comes back. And so you can always tell, even with me, when my hair fell out, because you'll always see these tiny little baby hairs sticking up, and you can see how many baby hairs I have and how recently my stress was. But so I always tell patients this is a good type of hair loss because usually you'll get this hair back, right? It's harder to hear that when you're going through the process, and sometimes patients don't believe me. They're losing so much hair and they're like, I don't know, how am I ever going to get this hair back? But it comes back for the most part. So yeah, I am seeing a ton of that. And I just want to kind of circle back to technology and the point you made about technology. This is unprecedented at this time, right? There have been pandemics in the past. You know, there was that great flu pandemic, and there's, you know, the SARS pandemic and bird flu, lots of pandemics in the past. But this is the first time where we've had this much connection with each other. And so what was really interesting, and I thought really novel and new, was how physicians now all over the world can collaborate and interact, and immediately within days there were Facebook groups of physicians, there are Facebook groups of dermatologists that were talking to each other like, hey, are you guys noticing this? Hey, are you guys noticing this? And I think this is something that's new that we've never seen before, and that's exciting. And we're kind of getting this firsthand glimpse into the scientific method right in front of our faces, and it's moving at such a fast pace. Information is changing by the day, but that's what science is, right? It's data driven. The data is going to change, and things change daily. You know, a lot of patients are like, I don't know what's going on. Things are changing so quickly. Yes, they are. But it's been exciting from my perspective as a physician to really see how physicians have come together. I mean, that's exciting. And I am just in awe of, especially you guys in New York, and the way that you've handled it. The European doctors, Italy, I mean, they've blown me away with their courage. And then the ones in China, I mean, just just, you know, unbelievably strong, tons of determination. The Chinese doctors, you know, fighting through their exhaustion, were writing case reports in real time and trying to give everybody else a head start and a glimpse of what was going on. So that has been really heartening to see. With all the badness that COVID brings with it, one of the good things is that we're able to talk to each other so openly and so freely, and we get real-time information, which is never happened before.
Yeah, I can't agree with you more. That's, you know, really beautifully said there. You know, honestly, when we started with our peak and our surge in New York, you know, we, you know, had been looking to countries that had already been through there, you know, been there. And, you know, just for, I think it's been a really nice collaborative time for medicine. And we really have noticed how we have so much technology at our fingertips that we just weren't using, you know, and so it is really, you know, as you mentioned, heartening to see that. Now we're just about out of time, but I'm going to ask you very quickly before you leave us. I know that you don't see pediatric patients as much, but if you wanted to just share with our audience, because, you know, you're an expert and you're a knowledgeable dermatologist, if you just want people to know in general, what are some of the common findings with COVID-19, skin findings in children?
So actually, I see a ton of pediatric dermatology, and I do it all the time, every day, all day. I just haven't seen a lot of COVID-related issues in pediatric patients. Young adults, for sure. You know, 18 to 25 age groups, I've seen a ton of COVID toes. I've seen a ton of viral exanthems and post-viral rashes. But in younger kids, I haven't seen much. And I think if you look at the data, because we want to know what the data is in areas where there were hotspots. There was a recent paper put out by a couple of derms at UAB where they compiled some of the data from a derm perspective. And in Spain, kind of at the height of the epidemic in Europe, they looked at these kids who were positive for you know, coronavirus. And out of 22 kids, they were able to test several of these children, and every single one of them came back PCR negative, right? So PCR is the molecular test we do to see if somebody has current active disease. And so all of these patients had milder disease, and they turned out to be PCR negative. So then the theory was, well, these are kind of milder patients. Maybe they had it before. And so maybe their antibody test will be positive. And so these patients then go on then to have, you know, negative antibody tests. So we can't quite get a positive test, you know, at the time. And then we can't quite get a negative or a positive antibody test. So it's really difficult now, based on the information that we have, to know if this is truly, you know, COVID related. Are the COVID toes truly COVID related? You know, I will tell you, I live in Virginia. We have all 4 seasons. It gets cold in Virginia in the winter. And I see pronio maybe once or twice a year. So it's not unusual for me to see it, but it's just not very common. So every year, you know, I'll see a couple cases of it. People were, you know, out hiking in the mountains or something, and you'll see people get chilblains, frostbite, COVID toes. But this time, the COVID toes, I mean, it's just a lot more. Several times a week, we would see this. Now, the question is, did people have these findings before, and because they're generally well, they just never sought medical attention? Or is this a new thing that's increasing in incidence? And so it's hard to know for sure. You know, there's so many theories. Is this are COVID toes a late finding? Is it an early finding? And then the whole, you know, discussion that you had with Dr. Mudgil about the reliability of these tests. Interestingly, I have tested about 7 patients in the pediatric age group for coronavirus that had some manifestations, COVID toes being the most common, and every single one of them was antibody negative. Every single one. And so, you know, it kind of across the board, we're seeing that. But does that really mean that they didn't have it? I don't know. We really don't know yet. Other rashes that I have been seeing in kids are just a lot of the post-viral exanthem. There's a rash that we see called pityriasis rosea that we see kind of in this season anyway. You know, we see large numbers of people get it in the spring, and then large numbers of people get it in the fall. and it's thought to be viral mediated, and we're just seeing a ton of it. But we usually around this time we see it anyway. But I am seeing greater numbers of it. So we're seeing these things, and we're observing these things are happening. We're just not sure about the implications of it, and are they truly related? We know that
I think you bring up a good point. Yeah, I think the main thing that I sort of spoke about earlier on my Instagram post was that we just don't have enough data in children, because essentially since the pandemic started, most countries globally have been on lockdown. Schools have been shut down as well. And so we don't have that much data in children. Now, in the last several weeks, we have an uptick in the number of cases in children just in the US. And so, with time, we're going to have more data and more answers, but, only time will tell. Well, I want to thank you so much for joining us today. And I look forward to chatting with you again soon.
This was fantastic. Thank you for including me.
We're going to get ready for our next guest. Take care.
Bye-bye.
All right, we are ready to go live with our final guest this evening. Hi.
Hi, how are you doing?
Hi, Elizabeth, how are you?
So good, thank you for having me. This has been great discussions.
Thank you so much for joining me and being part of this really important conversation so people can really get, good information from the experts in the field, in the industry. So before we get started, Elizabeth, I wanted to tell everybody formally an introduction about you. So I'm going to tell everyone, Dr. Elizabeth Houshmand is a double board certified dermatologist specializing in cutaneous laser surgery and dermatologic care of her patients with a special interest in cosmetic dermatology, laser medicine, acne, hair loss, and melasma. Dr. Houshmand completed her undergraduate degree with Presidential Honors Scholars from NYU and graduated medical school with prestigious clinical distinction honors. She completed an internal medicine residency at Georgetown University and is board certified in both internal medicine and dermatology. She completed her dermatology residency at Wright State University, where she was also a chief resident. She's an international speaker, a trainer, an author, and medical news correspondent, and an internationally recognized leader in cosmetic dermatology. Welcome, Dr. Houshmand.
Thank you so much for having me, Dr. Said. It's a pleasure to be here. I've been loving your Instagram. I've been seeing how you in New York from the beginning. I mean, I can't even imagine, because you guys, starting from very early on, were the epicenter. I am a former New Yorker, so I have a special place in my heart for New York. And I know that in the very early stages, the world revolves around New York. Everyone is from all over, and I can't even imagine, but I'm so glad to see the progression. I'm in Dallas, I'm in Texas, and unfortunately, we are where you guys were in March, April.
Exactly. I know. I was going to say exactly that you're in the hot spot right now in Dallas, and I hope you're staying safe. And I'm sure you're seeing, a good number of patients with coronavirus, what most likely it's telemedicine that you're doing at this point. But being that, you're in the hot spot right now, I mean, I know what you're going through, been there not too long ago, wouldn't really wish that upon anybody. But I wanted to talk with you a little bit about some of the common findings, with COVID. We spoke a little bit briefly with some of the other physicians that were on, and just briefly touched upon this notion of this entity called COVID toes, also known as pernio. And this is something that people hear very commonly, in the community. We started learning about it early on in the pandemic. And I was hoping that, you could enlighten us a little bit and talk a little bit about, that from your area of expertise.
Absolutely. So one of the great benefits of speaking internationally is I have a lot of colleagues all over. I've lectured in China. I have been to Shanghai. I have colleagues in our World Congress was in Milan. And the beautiful thing about this is I agree with Dr. Chaudhry that everyone is coming together and sharing information, data. What are you seeing? We have groups where we on WhatsApp where we're sending information to one another. So in China, it's very interesting. They did not have a large percentage. It's less than 2% of COVID toes that have been reported to date. However, in the Italian literature, they had up to 20%. So it's very interesting to me to see the differences in the different countries as to the percentages. In the US, we're more like the Italians. We've seen a fair amount. It happens actually not in the older populations, it's in the relatively young. And so that's a huge distinction, because when this all first started, we were under the impression that this is the disease only of the older generations, but it is most certainly is not. It affects everybody. It seems like we're getting more and more information every day. But in the US, the biggest subgroup is, so our American Academy of Dermatology has a COVID registry. So if we see someone with what we think is a COVID skin finding, whether it be perennial, anything else that we can't figure out, we can send that, and they're actually making a formal registry, which is outstanding. So if anyone would like to contribute, you can certainly contact. It's called AAD. It's our American Academy of Dermatology. Awesome website. You can send all your information and they will register it as part of the cases. But it is thought that this is microthrombi causing these lupus-like toes. Normally, as the other doctors have stated, we don't see a lot of chilblains. It's 106 here today, so it's hot.
Wow. Wow.
I mean, it's really hot here. And so that usually happens in the winter in Connecticut, New York, you know, different on the East Coast. But I haven't seen perennial. I trained in Ohio for my derm residency. I haven't seen perennial, honestly, since that time. Here in Texas, as a practitioner, I have not seen it. But with the COVID toes, it's microthrombi, which fits with the whole inflammatory concept. And what's scary to me is a hypercoagulable state. And the physicians in Italy did treat it with actually hydroxychloroquine. I know this is very controversial, but that's what, because there is no treatment for it. We don't, I mean, it was sort of like, well, let's try. And they actually did fairly well. And that makes sense, because if you think about it, you use Plaquenil or hydroxychloroquine in the lupus patients who similarly present. So the truthful answer is, because everyone always asks, what do you think of this? I sincerely, we don't know yet. We haven't had enough cases and enough data for me to say yes or for me to say no.
Yeah, that's great. You know, it's really insightful to have that information. I know we've been seeing the same kind of trends. You touched on a lot of really important points there that I want to just dive into a little bit more. You know, very interesting. Agree with you completely that, you know, we have been looking to, you know, our colleagues in healthcare globally as we've been going through this pandemic, and we have seen different things. You know, I agree with you again that, you know, we did not expect there to be many findings in children, but then for roughly 4 to 6 weeks after our surge in New York, we then started seeing these cases of multi-system inflammatory syndrome in children. And that was very soon after those first case reports out of the UK. And then similarly in Italy and Spain and Europe, they were seeing those kind of cases as well. We didn't really hear about that in Asia. So, you know, something new, a new finding. So we definitely are learning a lot about this virus every day, and there's still so much yet to learn. And I suspect that we're going to continue to uncover more and more information as we go through this, especially in the pediatric population. I feel that only time will tell.
I was going to ask you, as an infectious disease specialist, have you found during this time an increase in the childhood disorders of like measles, mumps, rubella, chickenpox, anything like that?
Not as of yet. Again, I'm focused on, I'm adult infectious diseases, not pediatrics, but I can tell you from the reporting, because obviously being an infectious disease, I'm aware of, you know, the outbreaks of the local public health issues. I think right now, because of, you know, coronavirus and this novel strain that came out, we actually saw essentially all other viruses kind of just die out. You know, we don't usually see that in the peak of our viral season. You know, in March, we expect to see large numbers of influenza and other respiratory illnesses. And once coronavirus was predominant, we really did not see anything else. So it's going to be interesting to see what happens in the fall. The problem with illnesses such as, you know, other viruses such as measles is, you know, there's been reports, you know, nationally, and I'm assuming that there's probably even more of, unfortunately, a decline in vaccinations for the pediatric population globally because of this pandemic. So, you know, the American Academy of Pediatrics has reported that because people were essentially afraid to take their children to the doctor's offices, the kids were not really getting vaccinated. It's only, I think, from ages 0 to 2 that, you know, people were really compliant with taking their infants in for, you know, their routine vaccinations. But then after that, it really dropped off. So the concern is now, as schools are going to be reopening, and with children that may be, you know, falling back on their vaccinations, is, you know, the last thing we really need is to be in the middle of a coronavirus pandemic of this scale, to have introduction of other viruses and other illnesses that are, you know, life-threatening and debilitating, you know, along with it. So we really are urging parents to really, you know, seek medical care and, you know, make sure that their children are up to date with their, you know, regular healthcare maintenance and their immunizations.
Absolutely. No, I could say it's unprecedented times, and with schools potentially reopening, it's going to be interesting to see what the next steps will be in management. I mean, we're all learning